Hello, and welcome to the Real Health Podcast. Today might sound a little bit different because I want to tell you about our Cancer Care Reimagined speaker series. When we began planning our 25th International Conference on Human Functioning, Dr. Ron Hunninghake sat down and created his dream team of speakers. We reached out to them, and much to our delight, they all said yes. Now our speakers are leaders in integrative oncology, functional medicine, and research who are truly shaping the future of cancer care. Each week leading up to the conference, we will feature one of these extraordinary experts right here on the Real Health Podcast. They will be sharing insights, innovation, and inspiration to help you reimagine what's possible in cancer care. This series and the upcoming conference would not be possible without the generous support of our presenting sponsor, Empower Pharmacy. Empower Pharmacy is the most advanced compounding pharmacy in the nation, licensed to serve in all 50 states. They are deeply committed to improving access to high-quality, affordable, and personalized medications for the patients, providers, and caregivers who rely on them. Their belief is simple but powerful. Behind every order is a person in need. And with that knowledge, they approach everything they do with compassion, innovation, and a drive for excellence. We are so grateful for their partnership and their support of this important conversation around reimagining cancer care. Tickets are on sale now for the conference at cancercarereimagined.org. We hope you will join us in Wichita this November for this unforgettable event.
Well, welcome everyone to another wonderful episode of the Real Health Podcast here at the Riordan Clinic. I'm Dr. Ron Hunninghake, and as my guest today, as she was in January of 2024, Dr. Michelle Niesley. I just introduced you, Michelle, as our new director of the science department here at research department here at Riordan Clinic.
Right.
And now you've become our CEO.
Right.
Bingo.
Yeah, it was not on my bingo card for this year.
Anyway, so I thought we would maybe fill in on our audience in terms of what's gone on and a little bit of background of you, maybe a little bit more background. Maybe we ought to refresh the audience. You're a naturopathic oncologist.
Yeah, so I am a naturopathic doctor specializing in integrative oncology. Yeah, I graduated from Bastyr University in Seattle in 2001 and completed a residency at Cancer Treatment Centers of America outside of Chicago, and then decided I needed more student debt. And so went on to Dartmouth and got a master's in biostatistics and epidemiology at their program there. So I've had an opportunity to direct clinical trials units. I've been primary care in Alaska. I worked at an integrative medicine center associated with Northwestern University in Chicago, and then owned my own clinic in Eugene, Oregon, starting in early 2016. Yeah.
Yeah, I kind of feel like you were destined to come here because, the Riordan Clinic, it's been in a leadership role in not only integrative medicine, but holistic medicine. When I first came here, that's what it was. It was holistic, orthomolecular, all kinds of different things that really opened my mind. As a conventional family physician, I started to see that there was a dimension of care that we were not giving to patients that Dr. Riordan discovered as integral to helping patients get over complex chronic illness.
Sure.
Because it's one thing to come in with a cold or a heart attack or whatever, but when you've got fatigue and you've got infection and you've got heavy metal toxicity, how in the world do you put that all together? And I guess the naturopathic background is what really brings this all forward.
Well, it was really something that was really interesting to me. I was looking at regular medical schools and met a classmate of mine, a collegiate classmate of mine on the street in Portland who happened to be going to naturopathic school and invited me to student for a day. So you got to see the classes and hear some cases. And the thing that really struck me about naturopathic medical school is you can have a diagnosis, but it doesn't tell you why. And so, one of the cases that we heard was about someone who had chronic sinusitis, right? And had surgeries and antibiotic use. And as the student had worked with them, they found out that patient had a milk sensitivity, a dairy sensitivity, and they had traded in their cup of coffee from home every day to, getting Starbucks that had opened up 3 years ago in their building. And that's when all of these issues started. And so I really liked the individualization and really figuring out the right answer for that particular patient, not necessarily the right answer for that diagnosis. So it's hard. I mean, the diagnosis tells you the symptoms, but it doesn't tell you why. And I think why is the really important question to ask.
Yeah, and as the whole concept of terrain comes into cancer care,
sure,
and really naturopathic oncologists introduce that concept that you can't just think of the cancer, you have to look at how has this affected, how is the digestive system, the gut microbiome, how is that?
Yeah.
How has your past experience, traumatic experiences, does that play into the cancer? So there's like 10 terrains that you can look at.
There are. And when I'm talking about it, and this is not my analogy, it is out there, but talking about cancer as a weed or as a plant of some sort, right? And when you talk about that weed, it's growing in soil. And so standard oncology is really focused on getting rid of the weed, right? They want to get rid of the weed. They can cut it out. They can use chemicals, chemotherapy, immunotherapy, targeted therapies. They can use radiation therapy, but conventional oncology really doesn't focus on the soil. And so for me, again, I can have two patients with on paper the identical diagnosis, of breast cancer. They receive the same conventional treatment, but when they come to me, if one has heavy metals and one has evidence of mold toxicity, even though on paper they're very similar patients, they're going to get really different plans from me. So it's really about individualizing.
Yeah. So let's carry that into the business of the Riordan Clinic.
Right.
So we have a kind of a diverse terrain here because we're dealing with patients in a whole different way than conventional doctors do. The patient comes in, they've got their disease, they've got their symptoms. The doctor does lab tests, takes an intake, and comes up with a diagnosis, and here's your treatment. Boom.
Right.
What's different here at the Riordan Clinic, and what was it that attracted you, and what was it that attracted me to make you the director here?
Well, so I would say in my time as research director, Riordan is internationally known for so many different things, but obviously intravenous vitamins, right? And where Dr. Riordan began. And really pushing that research early on, really establishing ourselves as research-based, and also really emphasizing the relationship with the patient as the co-learner and not being the doctor who's dictating, but really working in partnership with our co-learners is just so important. Yeah. And so it was, Riordan has always had a wonderful reputation. And so that attracted me to get this opportunity to work with a clinic that is internationally renowned. And then as I came to Riordan, I got called into more and more meetings about, our patient pathways and potential survivorship programs and different offerings that we are currently looking at right now. And it was just really interesting having been there in the day-to-day clinic basis and then being able to look at it from a business perspective too. It was an opportunity I couldn't refuse.
Yeah.
Yeah.
And so also when you jumped in, I think most of the people that are listeners may have heard that we're going to be having the 25th International Conference on Human Functioning. So Dr. Riordan was passionate about the education part of this, that as physicians who are looking for a broader understanding of what are the underlying causes of chronic illness, he invited people from all over the world for 17 international conferences while he was alive, and we've had another 7 since his passing, and now this will be our 25th international conference on human functioning. Cancer Care Reimagined.
It is. I'm going to give you all a little side story too, really quickly. Okay. So Dr. Ron, it is our 50th anniversary of the clinic, 25th International Conference. And so when we were planning this conference, we asked Dr. Ron to name his list of people that, speakers that he thought would be appropriate for this conference and would represent the material really well. And often when you're planning a conference, you'll have some speakers that have conflicts or can't speak for a variety of reasons. Literally every single speaker jumped at the opportunity to speak. And so thank you to Dr. Ron and your, over 30 years of, being at the Riordan Clinic and really establishing those relationships and connections. For Cancer Care Reimagined, we've got a wonderful lineup of, there's everyone from Naisha Winters to Polly Anderson, Dan Rubin, Dr. Bagley,
India, we're having
Manicom
is coming from India, England.
Yes, Mark
Sure.
Lintern. Yes, yes. So Lise Alschuler is coming. We've got just a whole host of wonderful speakers. And I think that the goal of the conference really is to acknowledge where we've been as far as integrative cancer care is concerned. It's changed a lot in my 24, almost 25 years in integrative medicine. So it's changed a lot, and acknowledging what those changes and what those breakthroughs have been, but really charting an innovative course forward.
Yeah. And you and I will be kicking off the conference.
We will be.
We're going to be talking about how important it is for us to understand how the brain plays into this, because what we now know is that most of modern medicine, as we currently understand it, is a left brain phenomenon, which of course we need. The left brain focuses in on the specifics, and thank God we have the knowledge that we have. But on the other side of the hemispheric world is the right brain, which is holistic, looking at the big picture.
Right.
And sometimes that's gotten lost in the whole development of medicine, Western medicine.
It has. And I think one of the things you and I have been discussing also is the corpus callosum and how it connects the two sides, but it also sends not all the information necessarily.
No, we have to really develop our corpus callosums because there's been a divide, a real divide between conventional and holistic alternative medicine. But it's been growing. Functional medicine has definitely made great strides. And now with integrative medicine, this is the corpus callosum. This is where we're going to bring this out at this conference, that if we're going to reimagine cancer care, we've got to get the two sides of the brain working together and getting people to understand that cancer, yes, it's a specific disease, a tumor that grows in your body, but this is getting back to the terrain.
Correct.
And unless you take into consideration terrain, you're not really treating the whole person, and we're not going to get as good a results as we could get.
Correct. And you're setting the patient potentially up not only for reoccurrence of cancer, but maybe if the cancer doesn't come back, are they getting set up for autoimmune diseases or cardiovascular disease or dementia or other ways that, again, if that soil isn't healthy, for lack of a better metaphor, if that soil isn't healthy, is that going to lead to other complex chronic illnesses down the road?
Yeah. And so this to me represents this is actually, you are really a third generation Riordan Clinic. You represent that. We have a number of young doctors and integrative oncologists on staff here, and people who are enthusiastic about bringing about this, what we've kind of been building up to, this innovation of the care of cancer patients, because now we've got a kind of an epidemic going on. We've got all these young people getting cancer. We've got the numbers are continuing to grow. The world we live in is more toxic than it's ever been. Radio waves and glyphosate, you name it. And so this type of specialty, I think, is calling us.
Yeah. And it's really been something I've seen over the past 25 years, is that we used to kind of be on the outskirts. And I think we really have seen integrative medicine not only infiltrate actually academic medical centers that have, integrative medicine centers there. We're actually within the NCCN guidelines now, which are part of the guidelines that oncologists follow in order to not only give treatment, but then also how to reduce side effects. So integrative medicine is represented there. There's hundreds of thousands of publications on integrative medicine and oncology, going from herbs to different types of diets, to exercise, to nutrition. So all of those things that we can do to support the patient. So we've become more mainstream, but we still have a long way to go.
Yeah. No, what I've really been impressed with you about is that you are very articulate and that you're willing to reach out, because I think it's, there's been a tendency, and at least in me, we kind of, let's do our little holistic medicine over here, and hopefully we don't rock the carriage or whatever. But I think we're at a stage now where we need to stand up and let people know what's going on in the world is really serious. I mean, our United States is not we're fairly low in the category of nations in terms of our healthcare system.
Yeah.
We need to rejuvenate it and revitalize it. And I think this is one way to do it, to bring in whole brain medicine.
Right. Whole brain medicine. And I really also, part of the reason I went to Dartmouth was so that I could speak the language of statistics. So when I was going to ASCO and other conferences where we were looking at all these different statistical different curves and graphs and everything, that I could speak the language just as well as my, conventional colleagues could. And to me, communication with people, with providers of all types, conventional providers, integrative providers, really what you're doing is building that bridge and not having the patient be stuck in the middle trying to follow, do I follow the integrative recommendations? Is my oncologist going to be okay with that? I mean, I really think so many things in life are about communication, experience, education, right? And once you learn more about something, it's not so scary. Once you can get the papers in front of, conventional oncologists, often there will be a recognition that there really is a significant place for this integrative approach.
Yeah. And it really does empower the patient.
Yes.
Very often the cancer patient's overwhelmed.
Yep.
They of course want to do the right thing, but they don't know really what their role in it, because in the past, the patient has been kind of like the object of the therapy.
Correct.
And we want the subject back in there.
Right.
And Dr. Riordan recognized that with the term co-learner. Mm-hmm. So our patients here are co-learners. They're actively involved in this.
Yes.
And I think what happens when you get people, doctors like yourself, that have the strong nutritional understanding, the ecological understanding, the whole person understanding, the patient then feels emboldened. And I think it actually helps their immune system, and their outcomes are going to be better just by that fact alone.
Yeah, absolutely. So, I mean, there's a lot of information on how stress reduction, can positively impact the immune system. Mm-hmm. And I think it's really what we are trying to do is provide them with that information so they can do something about what is happening. I mean, with chemotherapy, conventional therapies, a lot of times patients feel like things are being done to them. They're having surgery or chemotherapy is being administered. But like you were saying, how can I go ahead and empower myself to take the steps that I need? I often talk to my patients about, this visit is not a monologue, it's a dialogue. Right? So yes. The things that you tell me are going to better inform the recommendations that I'm going to make. I truly believe that most patients, if you listen to their story, that they will tell you exactly what it is that they need. Yeah. So.
Well, I've really enjoyed my 34 years at the Riordan Clinic, and I'm not leaving. I'm basically going to be cutting back a little bit as time goes on, but I really feel like putting the clinic in your able hands and all the wonderful staff that we have here, and also just the world is kind of saying, okay, we're ready now. Let's have more of a part in our own healthcare. And I think if the people that take a look at the Riordan Clinic, you'll see that we're moving into that big time.
We are. We're really looking at innovative ways to support our patients between visits, and making sure that they are well cared for. I mean, it's easy to give somebody a list of things to do at this appointment today and not see them for 30 days. Well, what happens over those 30 days? So I think that's something also when you talk about communication and support, it's something that conventional medicine to a certain degree is lacking. You usually get the care from your physician when you're in front of them and not necessarily, until the next appointment. And so laying that foundation for really building a community movement is the direction that we're headed.
Yeah. So the three pillars that Riordan built this facility on, the whole concept was innovation, patient care, and research. And so you kind of have a little bit of all of that in your background, in your pedigree, so to speak.
Yes.
And so that's why I was excited that you accepted to be
our
new director.
I was honored. Like I said, it was not anticipated. But when the opportunity came, it just right now just feels like it's the right time to be able to help Riordan get to the next level.
So we also want to make sure that everyone out there understands that the conference is open. All of the Riordan conferences over the years have been available. So it's not just for doctors. So if people as co-learners want to come, they're more than welcome to attend the conference.
Correct.
And it will be available both in person and online as well.
That is correct.
So that's coming up November the
7th and 8th.
7th and 8th.
Yes.
And it'll be at Wichita State.
That's correct.
Okay.
Yeah.
Well, thank you again for accepting the job and
Yes.
for being so enthusiastic
Thank
and
you for the
outgoing,
offer.
and I'm here to support you 100%.
Wonderful. I'm thrilled. I couldn't be more excited. So thank you.
Thank you for listening to the Real Health Podcast. This episode was brought to you by Empower Pharmacy, the most advanced compounding pharmacy and 503B outsourcing facility in the nation. Licensed in all 50 states, Empower is committed to improving access to safe, affordable, and personalized medications for patients, providers, and caregivers. Learn more at empowerpharmacy.com. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episode and show notes over at realhealthpodcasts.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.